Good morning and good afternoon and good evening to everybody. The first, in behalf of Amplify Sickle Cell Voices International, I would like to express our sad feeling, showing the empathy to the people of Great Britain, Australia, Canada, to every space in this world, losing such a leader, the Queen. She stands very strong with her nations, with the people with the weaknesses. She helped a lot of organizations to stand up. She encouraged a lot of leaders to amplify their voices. She established a lot of communities and organizations to help the communities. She did well, and she gained their respect. And if there is something to make this lose acceptable, that she left behind herself a lot of things, a lot of memories, good memories. She helped a lot of people, communities, not to express the war. That's a lot. Anyhow, we meet together today. Let me introduce myself. This is Zakareya AlKhadem from Bahrain, the chairperson of Amplify Sickle Cell Voices International Australia, and the chairperson of Bahrain Sickle Cell Society. I am a sickle cell warrior, like any sickle cell warrior in his journey, experiencing and tasted the losing game. Friends and happy days, and my health issues. When I met Agnes, my lady Agnes, I didn't thought that we can work together someday to bring our dream to come true. Building the first body that can bring all sickle cell communities together with the three main goals. Let me share my slides to help me to go much faster. So this is when we start building the body of Amplify Sickle Cell Voices. And we set three goals. The first goal was about how to build a long and healthy life and successful people living with sickle cell disease, doing well with sickle cell. The second, raising awareness, risks, challenges faced by people living with gene sickle cell. We have done a lot about sickle cell disease. Very rare when we talk about people and challenges, risk faced by sickle cell who carry the sickle cell trait. And the third goal is how to improve caring for Africa's sickle cell children. As WHO say, by 2030, 75% of children They may die before age 5. Can we slow down that disaster to may happen? Or can we prevent? This is the goal. So we end up with 3 products. We define our product. We call them as a product. Awareness, responsibility. We shall provide people awareness and to encourage people to act responsible. And we say that if people have awareness and to act responsible, that will create the hope that it will work. Me and you know sickle cell very complicated and need to be managed with. We keep going round cycle, talking about how we can help people with sickle cell. And we realize that we were only talking about medical side, but that made us go nowhere, except more confused and fed up to resolve sickle cell issues. You need to go for comprehensive care, and that includes living will and legalization. So we set the 3 tracks that may help us to reach our destination, how to improve quality of life, how to work therapy and the prevention. Therapy and prevention. And whenever we go to the field, we are looking for 2 elements. It's very expensive. These 2 elements is data and influence. We are looking to collect data and using that data to build a very huge influence. We are in 27 million people living with sickle cell and approximately 365 million people living with sickle cell trait. We are a huge nation with a dream. We had enough of everything, enough of ignorance, enough of poor influence, poor access to the healthcare, poor data to be provided to home concern. This researches, expensive medication, around regulation, live in fear. As Agnes said, think big, dream big, believe big, and that result will be big. So our dream was about how we establish the first virtual country, the Republic of Sickle Cell, will get the recognition, a residency, amplify voices, real actions, business opportunities. How to amplify or what to amplify? We set a lot of things. As you see here in the desk, we shall talk about the children period or adolescence period, the pregnant, how to save mother, save a pregnant, and about issues like disability, health assurance or insurance, the cost, the clinical studies, and the other side, how to do well in living, like either in the schooling, higher studies, finding or keeping a job, or to be entrepreneur, or retirement. Also, how to find the match, your partners, your talents, how to promote the success stories. So we define also our stakeholders. You can see there are a lot. And we categorize them in different segmentation that we can name different people who can go and focus and do work about these stakeholders. Principle of our journey. So we say that every sickle cell warrior deserves a medical care. It defined in these principles: to be saved, to be given a treatment or care to be saved on time, and about the patient, and should be effective, perfection, fairness, ethical. The strategy was 8. This is the fundamental, where all our body can stand on. So they established the national system in each country, then establish an elaborate system of care that ensures supportive service for clinical or non-clinical treatment. To standardize every country, to level up every country. So we know, everybody knows what we need. The third, strength the evidence-based and to bring the protocols, to improve the protocols, these studies. Also fourth, how to encourage and increase the number of qualified health professionals, either a nursing or a doctors, physicians. We have seen a lot of pediatricians with working for hematologists, but very few people in adults who show interest to work with sickle cell, adult sickle cell. 5, very few countries who make patient involved. So we say we shall improve sickle cell awareness and supporting patient association partnership. So we encourage the healthcare provider, organization, or health institution to allow patient to be in or to increase the patient involvement. 6, addressing the barriers. What make access easable? 7, implement a plan to increase understanding of impact of comprehensive sickle cell, and not to forget the sickle cell trait. The 8, how to create and to encourage governments to fund the research's agenda on effective program and policy to improve life expectancy. The structure was very easy to build after the first. After the strategy, we can go to the structure. Determination of social and structure burdens. All doctors or care providers know well about sickle cell, but they know less, the majority, they know less about the burden of sickle cell. Also, we shall demand for national registry, screening, and prevention program. Third, complication of sickle cell. We have to define the complication of sickle cell. When sickle cell Patient dying on age 5, doctors know little about sickle cell. When sickle cell start living up to 75, doctors started learning new things about complication and risk faced by sickle cell. Fourth, the role and the access of the healthcare institution. And let's say and see, explore what is the barriers, what makes things slow, what makes people delay, what makes people die in the emergency. Fifth, how to provide high quality sickle cell care, standardize. Six, contribute the development and introduction to new treatments. It's not acceptable that few people or few countries will get that the new treatments, and the majority, and especially Africa, they get no treatment, no access to the new treatment because it is too expensive, it's not affordable. Seventh, the importance of patient advocacy partnership. How to establish and encourage group of people to establish an advocacy movement. Evaluation of a strategic plan, action plan for the control of sickle cell disease. We have a threat. Doctor is not our enemy. Hospital is not our enemy. Who's our enemy? The drug dealers, the careless behavior, the woman rights, who's taking that woman rights. We have to raise this. We have to empower women and to see where we can protect these women. And another politician who come and abuse the sickle cell just for conflict. And we are very concerned about the conflict, and we advise people not to go for conflict in any level. The government rules we have to define, and we make things easier, clear, transparent to everybody to join our movement. Recognition, they have to recognize sickle cell as a public health issues, and to improve the access to the healthcare and the school, and to take care of adolescents, especially from shifting from adults or pediatric services to the adults. They are in the adolescents. And we have to count sickle cell within, recognize sickle cell is one of the chronic disease. And we shall have a registry, national registry for each country, screening, vaccination, and prevention. Patient involvement, we shall improve the trust awareness program, activity programs. And we have to recognize the training program, counted the number of hours, reinforcement program, clinical trials, multidisciplinary team who serve sickle cell. Regulation, employment, retirement, social allowance, disability, and how to fight stigma. Support, how to give support to the patient association, how to name number of board members in the government agency to improve the healthcare. Also, how to concern about emotional health, palliative care, not started at the final stage of the age, no, started from day one, when sickle cell kids born with sickle cell. That day, the palliative care should start. And the activity, how to improve the activities. So the challenges, things waiting for us to do, the branding for the Amplify Sickle Cell. We are going to speak new languages. We have to speak Spanish, English, French, Chinese, Arabic, all the languages. This is a good advantage. Third, recognition. Yes, we had recognition from Oman, and we've been recognized in Bahrain and recognized in Australia. And we are looking for much forward to be recognized in every country. We had an expansion from each country. From Australia, India, Arab countries, Africa, Europe, Canada, and USA. Sickle Cell World Days. Recognize the Sickle Cell World Days and Sickle Cell Month awareness. Palliative care and National Sickle Cell Awareness Month. And woman empowerment. These things is our target. Where about health care cost, this is challenge. Mortality challenge, how to reduce it. Stigma is a challenge. How to level up or increase the blood stock. How to do employment program. How to manage, to improve, increase the professional. How to fight the abuse. How to improve the health knowledge and reduce the illiteracy, how to bring the new therapy and make it accessible, how to talk about sickle cell trait, how to be transparency, how to fight dehydration, disability, to recognize our disability, what to do during travel and immigration, how to protect our people who travel and will medicate their medication, how to be involved in the clinical trials, how to deal with delay in the emergency room, what to do in the conflict, how to manage that conflict, how to establish multidisciplinary team, and to bring the new story or the new success story to our friends, to encourage them, how to move in this world geographically, and how to fight the poverty. There is a lot of people who are poor. We are going to promote our people, their arts, photographs, their story, their cartoons, their articles and books, their news, their awards, music, cinema, activity, short clips, food and recipes. We shall have a virtual mall that we sell books, we sell arts craft works, we sell products and goods, we sell medical devices, we sell fashion accessories, stores, agriculture, collection, application, and technology. How we can use this virtual? The Republic of Sickle Cell can bring the learning, virtual learning, scholarship. We can bring scholarship to our members, training courses, postgraduate program, languages, skills qualities, free courses, provide jobs opportunities, tuitions class, volunteer opportunities. We started already in Bahrain to do tuition classes. We can expand that also. This is the chart where we suggest to go, starting with Agnes. She is the governor of the Amplify Sickle Cell Voices. She chair two head. She is chairing two structure. One, the Amplify Sickle Cell. The second, the International Roller Board, where every country will have a role, and that roller or the leader will join the International Roller Board, will be chaired by Agnes. Zakareya will chair a number of deputies, one secretariat and one first deputy, and I may have 3 or 4 or 5 deputy. Each of them, they have a task to go for it. The secretarial, the secretary will lead or will do the news media, magazines and social media, and will connect with United Nations, WHO, governments, and the conferences and workplace. The first deputy will take care of these: educational awareness, international affairs, success stories, schools and college complaint, patient involvement, warrior affairs, activity and campaigns, and registry screening and prevention. Deputy of Medical Affairs has these things to do, and Deputy of Jobs and Legal Affairs also has number of activity and tasks to go for. Deputy of Fund and Business Affairs also he has a lot of things to go for it. Anyhow, thank you for listening and your patience. Hope that we meet very soon. Hope this dream come true and can help our colleagues and friends from around the world to work or to do well with sickle cell. Thank you.